You know, we've been taking care of heart failure patients for a very long time, and it's always been a challenge. And there's been plenty of studies to show that it's difficult to really assess a heart failure patient adequately. You know, some of the things we look at, people have a lot of symptoms. Some of them are due to heart failure, and some of them aren't. So before we had technology available to help us monitor these things, you know, we would do a physical exam, we'd use our stethoscope, we'd sort of use these sort of antiquated tools to try and figure out a very complicated disease process. When patients with heart failure get symptomatic, the main reason they get symptomatic is because they have fluid overload. They have fluid in their legs, they have fluid in their lungs. And now we're talking about a device that you can put on the device and say, look, I can assess directly the cause of your symptoms and how bad it is. Previous to that, what we had is we had the clinical exam, we had a stethoscope, and then we had the only other options were invasive monitoring. We had to put a catheter in, or we'd have some other device that was implantable. And now we have a device that somebody can sit in a chair, we put it on, and 90 seconds later, we have the number we're looking for. It's pretty good technology, a pretty good weapon to have in your arsenal.
So the REDS vest is a wearable device that measures the patient's lung fluid and helps clinicians assess whether the patient's symptoms of shortness of breath are related to their heart failure symptoms with extra fluid on board versus some other disease state that could be affecting their shortness of breath.
Thinking that the patient's ready to go home, and maybe they are, but then they relapse, and 2 weeks later, 3 weeks later, 4 weeks later, they're back again, creates huge cost problems and even some financial problems now for the healthcare providers. Talk to me about that aspect of it.
Yeah, so a major problem in heart failure is its high readmission rate. It turns out that the 30-day rate of readmission for heart failure is higher than any other medical or surgical cause of hospitalization. So this really is a major and growing public health concern. We need better tools like REDS to help us improve patient status, keep them well, and keep them out of the hospital.